Hello everybody, this is Dave from Burke and Eisner, and today I want to do a quick overview on aplastic anemia, what it is and what some of its symptoms are and what some of its causes might be. Aplastic anemia is basically a disease of the blood, and it's when the bone marrow really doesn't produce all three types of blood cells. So anemia is another word that's in there, aplastic anemia. Anemia really is a reduction of red cell concentration. Aplastic anemia is when all three blood cells have a much lower count. One of the main causes of aplastic anemia is exposure to a carcinogen called benzene. Benzene is basically an organic solvent, and it is found in its pure form, benzene. It's also found in petroleum products, gasoline, some printing inks, and any kind of or used to be at least, in many kinds of cleaning solvents. So if someone has a large amount of exposure to cleaning out petroleum tanks or printing, this is where we often see aplastic anemia and benzene together. Some of the symptoms that we've seen with aplastic anemia are hemorrhaging, some excessive bruising, increased risk of infection, or pale skin tone. Treatment that we've seen is really a wide variety of drugs. I did not list them here because medicine is developing all the time and changing. One of the other major kinds of treatment is also a bone marrow transplant. So you might see that where you're trying to jumpstart the system to start creating the appropriate kinds of blood cells again. This has been brought to you by Burke and Eisner. We're a national law firm, and we do help people who have exposure to benzene and who have contracted one of a number of diseases as a result, and one of them is aplastic anemia. We can be reached at www.burke-eisner.com or 1-800-838-0800.